1. A senior faculty member is designing a curriculum for internal medicine residents that incorporates spaced repetition and interleaving. Which adult learning principle is most directly being applied in this scenario? A. Self-directed learning. B. Metacognitive scaffolding. C. Cognitive load management. D. Retrieval practice. 2. An internal medicine program director wants to evaluate the effectiveness of a new telehealth training module. Which evaluation method would provide the most direct evidence of learner behavior change in clinical settings? A. Pre- and post-test knowledge assessments. B. Simulation-based skill assessments. C. 360-degree feedback from patients and peers. D. Focus groups on learner satisfaction. 3. A new attending struggles to mentor a resident who lacks confidence despite strong clinical knowledge. Which mentoring technique would best support the resident's growth? A. Provide continuous positive reinforcement only. B. Offer task-specific feedback with progressive autonomy. C. Assign high-stakes cases to boost resilience. D. Recommend external coaching services. 4. A faculty member is designing a CME course aligned with ABIM maintenance of certification MOC standards. What is the most critical regulatory compliance issue to address during curriculum development? A. Ensuring the course meets ADA accessibility standards. B. Confirming the course is peer-reviewed. C. Verifying alignment with ABIM's Part 2 lifelong learning requirements. D. Limiting the number of questions per module. 5. In teaching clinical decision-making, a facilitator emphasizes learner experience, problem-solving, and reflection. This aligns most closely with which adult learning theory? A. Constructivism. B. Behaviorism. C. Social cognitive theory. D. Connectivism. 6. During evaluation of a faculty-led case conference series, residents report increased confidence but show no improvement in board scores. What is the best interpretation of these findings? A. The evaluation method was flawed. B. The learning objectives were not clearly defined. C. The teaching approach increased self-efficacy without affecting knowledge. D. The learners did not engage with the content. 7. Which of the following best demonstrates effective curriculum mapping for an ABIM-aligned internal medicine residency? A. Listing all topics covered in morning report sessions. B. Aligning learning objectives with ACGME core competencies. C. Incorporating only topics that are tested on the ABIM exam. D. Using faculty opinion to prioritize content areas. 8. A new policy requires documentation of all teaching activities related to MOC. What is the best strategy to ensure compliance without disrupting teaching flow? A. Require real-time electronic documentation after each session. B. Assign an administrative assistant to track activities. C. Incorporate automated logging into the learning management system. D. Use quarterly surveys to estimate time spent teaching. 9. A clinical instructor notices a learner repeatedly misinterprets lab values. What is the most appropriate next step using formative evaluation? A. Assign a summative multiple-choice exam. B. Observe the learner in multiple clinical encounters. C. Delay feedback until end-of-rotation assessment. D. Recommend the learner audit an online course. 10. In a faculty development workshop, participants are encouraged to share challenges and develop action plans. This approach best supports which adult learning principle? A. Immediate feedback. B. Learner readiness. C. Self-reflection and autonomy. D. Passive knowledge transfer. 11. Which mentoring approach is most suitable for fostering long-term professional identity formation in internal medicine trainees? A. Performance coaching based on procedural metrics. B. Episodic feedback based on test scores. C. Narrative-based mentorship grounded in values and career goals. D. Peer-to-peer mentoring on exam preparation. 12. A residency program wants to evaluate its effectiveness in preparing graduates for ABIM certification. What is the most appropriate evaluation framework to use? A. Bloom's taxonomy. B. Moore's outcomes levels. C. Dreyfus model of skill acquisition. D. Maslow's hierarchy of needs. 13. A clinical educator creates modules that progressively build on each other and require learners to revisit earlier content. This best illustrates which instructional design strategy? A. Spiral curriculum. B. Blocked scheduling. C. One-time competency exposure. D. Flipped classroom. 14. An attending physician receives feedback that their lectures are too advanced for PGY1 residents. What instructional strategy would best support differentiated learning? A. Eliminate advanced content entirely. B. Segment learners by level and adjust content accordingly. C. Provide lectures at a PGY3 level for all learners. D. Focus only on basic science concepts. 15. Which of the following is a key requirement under ABIM's MOC program for maintaining board certification? A. Completing a clinical fellowship every 10 years. B. Demonstrating ongoing participation in quality improvement activities. C. Publishing at least 2 peer-reviewed research articles. D. Attending a national board review course. 16. A faculty mentor helps a trainee outline steps to apply for a research grant, encouraging independence while remaining available for guidance. This reflects what type of mentoring? A. Instrumental mentoring. B. Sponsorship. C. Developmental mentoring. D. Directive mentoring. 17. A curriculum developer is asked to incorporate health equity principles into the core internal medicine curriculum. What is the most appropriate first step? A. Add a lecture on health disparities. B. Identify existing gaps in current curriculum using a needs assessment. C. Require faculty to attend cultural sensitivity training. D. Incorporate a mandatory ethics module. 18. A program evaluation reveals high learner satisfaction but poor performance on clinical skills assessments. What should be the program's priority action? A. Replace faculty who taught those modules. B. Increase time spent on test preparation. C. Reassess instructional methods and clinical skills integration. D. Focus on improving learner morale. 19. A faculty member mentoring an underperforming resident adopts a strengths-based approach. What is the primary benefit of this strategy? A. Reduces pressure to meet minimum standards. B. Allows for dismissal based on objective criteria. C. Builds confidence by leveraging existing competencies. D. Prevents over-reliance on remediation plans. 20. Which of the following strategies most effectively promotes regulatory compliance in curriculum documentation? A. Storing all materials in personal hard drives. B. Developing standardized templates and checklists. C. Relying on faculty memory during audits. D. Avoiding digital systems for security reasons. American Board of Internal Medicine ABIM. The American Board of Internal Medicine ABIM test is a rigorous, standardized examination designed to assess the knowledge, clinical judgment, and professional competencies of physicians seeking board certification in internal medicine and its subspecialties. Developed by the ABIM, the test evaluates a candidate's ability to diagnose, manage, and prevent a wide range of adult diseases across diverse clinical settings. It emphasizes evidence-based practice, patient safety, and ethical decision-making. The exam is typically taken after completion of an accredited internal medicine residency and may also serve as part of the maintenance of certification mksap process. Success on the ABIM test demonstrates that a physician meets nationally recognized standards and is committed to ongoing professional development and high-quality patient care. Here are the top 5 beneficial uses of ABIM exam. 1. Validation of clinical competency. The ABIM test ensures that physicians have met rigorous national standards in internal medicine, confirming their ability to provide safe, effective, evidence-based care. 2. Credentialing and licensure support. Passing the ABIM test is often required for hospital privileges, insurance panel inclusion, and state licensure, enhancing professional credibility. 3. Career advancement and specialization. Board certification through the ABIM opens doors to subspecialty training, academic positions, leadership roles, and increased earning potential. 4. Patient trust and confidence. Certification signals a commitment to quality and lifelong learning, helping patients choose qualified physicians. 5. Continuous professional development. The ABIM test supports ongoing education through the maintenance of certification mksap, encouraging physicians to stay current with evolving medical standards.